Anyone that has suffered from accident or some kind of a acute trauma, these are a little bit more challenging to resolve because traumas create central nervous system, fight or flight traumas. So you're talking about a brain center and its ability to get reestablished. There are things that, that I've been taught and that I've done through the natural world to help reset the central nervous system so that honestly it can recognize the body and what has been broken or traumatized or scarred. Many times you can work on the physical body, but if the brain is not connected, that is the lingering discouragement that many have after a form of trauma. So the key in the recovery or the success to recovery is one, making sure that the brain is in the game. And that can be a little tricky. Number two is that we have many predisposed conditions in our body. Meaning, I'll just do the classic TMJ. Many people after a car accident and a jarring force can never quite resolve the TMJ, the joint. And that is, we walk around most of our life with what we call predisposed. There's not many that come out of the womb and have a perfect joint. But as humans, we adapt. We're never balanced. We're always uneven on one side, but our brain center adapts us. And so when we have such a jarring trauma to our life, the predisposed that has always been adapted sometimes now has to be fixed because the brain identifies it as something that wasn't balanced when we were born. And now it's a big challenge. The joint doesn't just spring back when we have time to heal. We actually have to go in and get the brain and the joint in its proper position in order for it to fully repair. And those are things that are wonderful when you can tap into that little, I call it that computer chip, and find out what it's asking for to get you to the final healing point.